everybody. Sorry about that. Look at that. Now we're both in the frame. I am Yolanda Harper. I am co-founder of Harper Therapy, and today I'm here with Christian, who is our client care coordinator. Amazing. He's the one that when you call the office, you are more than likely going to be talking with Christian.
I'm the voice behind the phone.
You are the voice behind the phone.
That's
you're
me.
You're the man behind the curtain.
That's me.
That's you. And he does a great job. And because there are some regular questions that come up about our practice, the way that we do things here, I thought that it would be good for us to hop on together.
For sure.
And talk through some of those things.
Sure.
So what are some of the things that people ask about when they call?
I think the first thing that people want to know is if we take insurance. Our practice, we are out-of-network providers with insurance companies, and basically what that means is that we're a self-pay practice here. We don't take insurance. We can help you use your out-of-network benefits through your out-of-network provider in order to get a reimbursement from them by sending you a super bill, which is basically a receipt that you can send to them for reimbursement. But we definitely don't deal with insurance directly here. We are a self-pay practice.
Yeah, and so since there are so many different insurance companies and policies, that's a whole profession in and of itself.
Should be, yeah.
And we really want to focus on giving high quality mental health care. That's our wheelhouse. That's what we're best at doing.
Yep.
And what we've learned over time is that a lot of times in working with the insurance companies, it kind of constricts or restricts the way that we're able to help people.
Right.
And we want to give our highest and best. So we do our best to help you with navigating through your out-of-network benefits, so that you can go through that route. We use Reimbursify.
Right.
It's one of the organizations that helps with that.
Right.
So, awesome. What is the next question?
Probably the next people are wondering, with the whole pandemic that going on the last year, is if we are seeing patients in person right now. We are currently seeing in-person patients or virtually, depending what your preference is. If you'd rather do telehealth, we can definitely do telehealth with you there. We are all vaccinated at the office, so that's kind of a conversation you can have with the potential clinician that you're signing up with. But as far as we're starting to move away from wearing face masks in the office and stuff like that.
During the height of things, we were seeing clients with face masks.
Right. Right. But now we're starting to move back towards, I guess, a level of normalcy.
For the moment.
Right? Right.
So yes, we're seeing people both virtually and in person. And pre-pandemic, we were only seeing people in person.
Right.
So it is a nice option for people to be able to kind of log onto their computer and see their therapist.
Right. Or just switch back, back and forth. We know your schedule gets crazy, and 1 week it might work for in person, and 1 week it might be better for you to just do it from your home. We can definitely help with that.
Yeah. Awesome. What's next?
Next thing is people want to know what we can help out with.
That's a good question.
So as far as that, the practice is a trauma practice. We definitely specialize in working with individuals who are experiencing trauma, anxiety, depression, PTSD, grief, anything along those lines. We also specialize in working with couples with premarital counseling, marriage counseling in that capacity, and we do help teens above the age of 14 as well. Kind of high school age teens with the anxiety, the depression, everything that goes along with that.
Yeah, and we've talked a lot over the years about kind of the different definitions of trauma or different experiences that people have that are traumatic. Definitely what we've all been through the past year with the pandemic is a collective trauma, a lot of grief. Our wheelhouse is trauma and really the effects of trauma on relationships, which is one of the reasons that we see couples as well.
Right.
And we know that our teens are not immune to that. So we
Right.
want to be that safe place for our teens who have been going through the ringer as well.
For
so
sure.
anything trauma related in relationship. Yeah. What else?
Weekly sessions.
This is a really good one.
Right. People want to know how consistent they need to be coming in for therapy. With our practice, the expectation is weekly sessions. We want to get you a lot of momentum going forward, completing the goals and stuff that you have coming into therapy. And we have found that, the best way to do that is to have you come in weekly, see us weekly. And you can talk from the clinical perspective what that looks like as far as getting work done.
It is a commitment that we're asking. Like, we want to help you reach your goals as quickly as possible. And like over the years over the decade plus that I have been doing trauma work and seeing clients, I've tried kind of spacing things out, but to be perfectly honest, you're going to save time and money.
That's the big one. By
coming in weekly. We're just going to be able to work on the momentum. Otherwise, if you're coming in every other week, or heaven forbid once a month, we're just playing catch up. You're just telling us what's been going on in your life since the last session.
You're not making any progress.
That's not progress. So we want you to be feeling better. We want you to be doing better. And we ask you to commit to weekly therapy. That's why.
For sure. That being said, we know weekly therapy is a lot to ask for a commitment wise. We do offer consultations with any of our clinicians here. Consultation with our practice, it's a 15-minute phone call with the clinician prior to scheduling any appointments with them. It's completely free, and it's an opportunity for you to ask any questions you might have, get to know the clinician a little bit, and make sure they're going to be the right fit for you before committing to the weekly therapy. We do, on our website as well, have a about section at the homepage that you can view all of our clinicians there. Each of them has written a lovely bio about themselves, so you can kind of click there, click on their pictures, and read specifically more about information there on them.
You can find out information about our clinicians, information about our services. It's all right there on our spiffy brand new website. Yeah. And exactly. Then how soon can people get in?
Right now, we have availability as soon as next week.
Slots. It is pretty limited.
Slots are very limited right now. But that being said, it's a revolving door here. People are coming in, people are leaving. And right now,
as people graduate from therapy, we're not in the business of keeping you in therapy forever, right? Our whole goal is we bring you in, we ask you right away what are your goals, and we're regularly checking in with you to make sure that you feel like you're making progress on those goals, so that you can graduate, so that you can move on and take all of the tools and skills and growth that you've gotten from your time here with you. So yes, I mean, we do have sessions kind of opening here and there, but right now things are there's some limited availability.
Yeah, some limited availability, but things are a little tight. But just give us a call, see what we have available. You'll be talking to me, and I'm more than happy to go over who's available as a clinician and what that looks like for them.
Yeah. Anything else you think would be helpful for people to know?
We got 2 therapy dogs here. They're pretty cute. You can request them to be in sessions. Usually they're in the office Tuesdays, Wednesdays, and Thursdays.
Actually, we're training a 3rd therapy dog.
There's a 3rd one coming.
Yeah, one of our clinicians has brought in a therapy dog as well.
So
they're right here at our feet too.
if you like cute little cuddly things, we definitely got you covered there.
Awesome. Thanks for bringing that up.
Yeah.
All right, everyone. Thank you so much for checking us out. Check out the website. And again, if you have questions, this is the man to talk to.
For sure. I'm more than happy to help you out. You can call our number at 813-434-3639, or you can shoot me an email at info@harpertherapy.com. Either of those, you'll get in contact with me for sure.
Perfect. Thanks, Christian.
Yeah, no problem.
Awesome. Talk to you guys soon.